people are considering the surgery and they're apprehensive about the sternotomy. They read and they're hearing about robotic surgical unroofing at this point, and obviously less pain, faster recovery times, less trauma to the body. Can you comment a little bit about what you're seeing in terms of robotic at this point?
One of the main limitations for robotic surgery is that the main surgical robot no longer maintains the appropriate equipment or makes it for the current editions of the surgical robot to do the surgery. I know it's been done and been done safely. I'm not sure it's going to be universally applicable because when the coronary travels within the ventricle, that opens up, or sometimes we see just pure muscle over the top that's easily separatable. Sometimes there's some scar tissue that doesn't come off the blood vessel quite as easily, and I see that as being potentially problematic with the robotic approach. I certainly recognize its appeal, right? Having your chest cracked open is worse than having a minimally invasive surgery, is worse than having a robotic surgery from the patient's perspective. Some of that, I guess, perception and marketing than real. So certainly with minimally invasive, if you can perform the same surgery and do it with less trauma, that's a better thing. I agree with that completely. I do minimally invasive valve surgeries. I do robotically assisted bypass surgeries. I think that's the way we should be headed. The equipment doesn't exist to do it for everyone at this time, and there are going to be some people that aren't going to be candidates based on their anatomy. And I also think robot surgery, the perception that it's a quick fix and that you're going to come in one day and go back and be completely normal tomorrow is unrealistic at this time.
Thank you for that, because a lot of people are just waiting, and in some cases they may wait. They're wasting quality of life time, whereas a healing of 8 to 12 weeks from a sternotomy is it's relatively short when you think about it in the grand scheme of things.
For all the years down the road, yes.
I came in
but I mean, I can understand how, right? I'm not the one that's going through that. So, right, it's a balance of what the symptoms are and how difficult that is for you on a day-to-day basis, and what your own internal value system is for what costs you're willing to pay to have a very good chance of having those symptoms go away.